guys. So in today's episode, we're going to be talking about taking charge of the exam room. We'll be giving some examples of how patients try to dictate how their exams are going to go, what we should do for them. They come in with, I want this, this, and this, and you're going to do that and nothing else, when we're the doctors and we know what is best for them. So we're giving some examples of those incidents and how we overcame those problems, and also just tips and tricks for new grads and how to make sure you remain confident when giving exams when you first start out, and how to take control of your exam room. Because at the end of the day, everything that you do does fall back on you and only you and your license. And that's what you work so hard for and are an optometrist for. All right, so we're gonna get it started and listen up.
Hey, look, man, patience. Hey, look, patience. And really, hey, just record all this because we starting right now. But look, like at the end of the day, patients really be trying it for real.
Who gonna check me, boo?
And I'm trying to figure out for the life of me where that culture came from, where they felt like that, you know what I mean? Like you could come in and just kind of dictate, you know what I'm saying? Like dictate how you expect that exam to go, right? Where I could tell you to do something and you're like, nah, I'm not doing that. Nah, let's do it this way. You know what I'm saying? I don't know, man. Like it's really confusing to me. You know what I'm saying? Because it's come to a point where it's almost as if you just kind of like, you scratch your head and you're like, okay.
So you really want me to do my job? And I could actually make you see better than what you...
Yeah, yeah. I mean, some patients, are like, oh, you're the doctor, you know what I'm saying? You tell me what, you know what I'm saying? Like, hey, you tell me what I should do, I'm gonna do it. They're like, yes or no, sir, I'm gonna do it. And I'm like, yeah, for sure. But then the other ones are just like, they come in like, yeah, so this was my other prescription. So why does my prescription have to change? What are you talking about? What are you here for again? And and a lot of it is like, it kind of frustrates you in a way because you're trying to figure out like, how do you always address that elephant in the room? You know what I'm saying? How do we constantly, attack this issue? You know what I'm saying? And my thing is like, is this something that all ODs face? Because sometimes I feel like when you go back to traditionally, the OD was an old white male. It seems like there's a little bit more credibility that they hold and carry that nobody really questions them. And it seems like when it comes to
even when they're wrong, that's wrong.
What gets
started in there? Keep it.
This
going.
What gets me sometimes is I'll be the one that told you about XYZ, what's going on with your eyes, but they seem to always remember the male physician or the male optometrist working with, and I'm like, no, actually it was me who told you. Like you didn't like. So it does go, and that again, even a female aspect of it, like how we're maybe not viewed as far as having as much control in our exam rooms, because they're like, oh well, she's the woman, like she doesn't maybe know as much as this man. They don't have that dominance of taking over the exam room like this guy can control the exam room. So I kind of feel that in a woman's standpoint, they ain't looking at us like that sometimes, like, oh, she knows what she's doing. So
they're shocked when you do, to be honest. Like you'll see their contacts and they'll be like, I can see better. Really? Yeah, I was right. Like, what do you like? I think I know what I'm doing. Like, I didn't think you knew what you were doing before. I wasn't sure if this was gonna work.
Or hold on, this was good too, to go off of yours. Or they give you the fact check. You did your entire exam, and at the end, you give them the diagnosis, you give them the treatment, the assessment, the plan, you give it to them all, and they say, yeah, that's what my last doctor said too. Yeah. He said something about cataracts too. Yeah. Okay, doc, you guys are lining up. You get that feeling with like, all right, I didn't need his fact check to do my
they try to. Right, they try to make sure you credible. They try to verify you through their last OD, and it's like, hold on now, we starting fresh, brand new. You know what I mean?
Brand new.
I don't know, and I don't know if that's based on, and I'll kind of pick on you, Cortez, to kind of get your perspective, but I don't know if that's because we're not running the show in our modes of practice. Because like you run your show, and have you experienced any type of situation where patients are trying to control whether it be your exam or your assessment or your treatment or your plan about how you go about what you do?
I would say, yeah, it happens probably at least a couple times a week. This is a very common thing that happens, whether you're not in the private practice so much, because if they come to the private practice, they know they're going to see you. They know what they're coming from. I've had patients call today that I saw them in another location. They're calling me to ask about a diagnosis I gave for a cataract somewhere else. Hey, doc, do you think I really need that upgraded lens? Or, hey, doc, they're about to send me over here. What do you think? They're calling me at my practice about something I diagnosed and sent out from another place. So they'll find you if they really trust you and they want to be a part of your practice and growing. So I would say, yes, I do experience it, but I'm very firm. I'm like, hey, this is what I found. We did the whole exam. I was very thorough. You can always get a second opinion. That's big on me. Like, hey, if you don't feel confident in what I did, or you're just unsure, even though the exam went smoothly, I encourage you to go get a second opinion. There's a such and such place here. There's a place here, but you're not going to tell me what to give you. What I do give two options. When it comes to contact lenses and things, I give them the best option I can give them, and I give them what they're used to wearing. And I say, hey, I'm going to write both of these on the chart. You know what you had? I'm going to recommend this. You can try this out for a week or two, and you let me know towards the end what you think. I'll write a prescription for both, and you make a decision how you want to spend your money. But if they're a contact lens patient, they've been doing this for years, they've been wearing the same lens. If they are happy with it, I don't force them to switch it. They're happy.
What about the parent that comes in with their child that's just starting to wear contacts and they don't pass their class, and they're like, oh, well, I wear contacts, I'll just do it at home?
That's a hard no. That's a hard no for me.
I said, I need to see you put them in and take them out successfully before you can leave here with them. And if we can't get it done within 30 minutes, if it's taking an hour, hey, we need to reschedule for another visit. We need to try this another time, because the eye is bloodshot red. I let you poke yourself a million times. I'm not sending you home with that. So your parents is going to be mad. And then I might get that review later that said, the doc didn't. No, it's just I'm doing proper care, and you didn't like the judgment call I made, and now you have to go lash out. But then that's part of the game.
Right.
I'll take it a step further. For kids, new teenagers, young kids, like I'll go as far as only put them in daily contacts, and parents always push back. That's too expensive, but my other kid wears these contacts, or I wear these contacts. Well, I didn't see your other kid. I didn't start your other kid in contacts. If your kid's gonna get contacts from me, from my practice with my name on it, they're going to be daily wear contacts, because that's what I believe in for a kid. So, like, parents are going to push back on your decisions, but you have to stand firm in what you believe and what you believe is healthiest. And that's my job as a doctor. If you don't like it, okay, find a different doctor. But that's just how I feel about it.
It's funny that you bring up a good point, because I mean, if you're 13 and you want to wear contact lenses and you're like an athlete or something, it's a lot of it is recommended for you to go daily. But that speaks to like a compromise sometimes. Like there's moments sometimes we compromise on things. You know what I'm saying? Like sometimes I'll go ahead and go a monthly, monthly for them, just because I know it's a little bit more affordable for them, or 2 week for them, because I know it's a little bit more affordable. Even though I know, man, really this kid should probably be in a daily. You know what I mean?
Yeah.
But if the daily is so out of their budget, they personally, the parent doesn't wear dailies, they wear monthlies or 2 weeks, and they're like, I don't see why I can't. And that speaks to like that. Hey, look, when you give your recommendation and when you give your treatment plan or whatever it is, you're putting everything on the line to say that. You're putting your license on the line whenever we do what we do, and when we say what we say, we don't say it frivolously. We don't say it. We say it very cautiously with a lot of fear and trembling, because we understand that like eyes are on the line, health is on the line. You know what I mean? And it just goes to show that like even in a situation like that, you're not bending. You're very like, nah, I know this kid needs to be in a daily. Even if the patient's parent is kind of pushing back, you're standing firm on that. Because I found myself many times kind of going the other way and saying, let me appease the patient, make them a little bit more happier, just to kind of get them in that contact lens so we can still make that sale. You know what I mean?
Yeah, I mean, when you think of it though, they are medical devices. So there has to be some form of standard of care there, or again, you are putting yourself at risk of, your license and all that. So when we say, oh, it's not technically against the law, it's just more a standard of care. I mean, you don't want to develop an ulcer either. and you don't want to be liable if this person pokes themselves in the eye and, you know, is calling you and get their contact out. So you
and
really ground in these instances, because if not, you're yourself at further liability.
Right. And kind of the reason why for maybe somebody who may not understand or what we're talking about, to sign it, maybe break down why we would say we want to put somebody, because some people might listen to this and say, well, I don't know what the big deal is. You talk about how like a kid, like the propensity for a kid to put bacteria directly on their eyes, and talk about that a little bit more, because you do that. So
let me take an example. So like, would you trust your kid to like brush your teeth, clean your car, like do your laundry? Like, do you trust your 13-year-old son to clean your stuff as clean as you clean your stuff? Probably not. The same thing with contacts. Like, do you trust your kid to clean your contacts where you put your contacts in your eye? No. Most adults already have really bad contact lens care habits, right? And so I don't want the parents to pass on their poor habits to the kid, because it's a lot harder for you to break a bad habit than to just go ahead and start off with fresh, good habits and never start bad habits. So for kids, if you're wearing a daily disposable contact, one, a new contact lens wearer isn't going to wear their contacts every single day, because it takes them a lot longer just to put them in every morning. And so once you're in dailies, they're going to probably wear the contacts maybe like once or twice a week for the first couple of months, and like build up to wearing them every day because they get better at it. And so every time they're putting the contact in their eye, it's a fresh contact lens. They don't have to worry about, oh, I fell asleep in it, or, oh, I don't know how long it's sitting in solution, or, oh, it fell on the floor. Let me like clean it or not clean it and put it in my eye.
Right, because
oh, my
what's
eye's
a 13?
red.
Because what's a 13-year-old gonna do? It's gonna fall on the floor and they're gonna say, "Oh well," and they just
They're gonna look at it and be like,
or they're gonna eat hot Cheetos.
yeah.
They're gonna eat hot Cheetos. They're gonna eat hot Cheetos, and they're gonna be doing, like, because they just don't, or they're gonna be playing like sports, and they're gonna be touching the ground and grass and dead basketballs.
Who was it that was in the middle of the game?
That was James Harden.
That was
licked it. Oh, I don't. Hold on. Who licked
it? They licked it.
Who was?
Yeah. Who was that? Cortez. Who was that?
I know I vaguely remember. I'm trying to get it back.
Oh, boy, from
Draymond. Hey, put Draymond Green face up. Hey, put his face up right now.
Put his face up. I'm gonna put some arrows.
Come to the altar. Come to the altar, man. Hey, come to the front of the congregation. You know what I'm saying? Don't ever do them like that again.
But that goes on to say, that's just the point. That's just the point. Like, so adults have bad contact lens habits, right? So like, I don't want the parent to pass on their bad habits to their kids. So I feel like if I stand firm in saying that, no, your kid has to be a daily disposable contacts, they'll listen to me, because they're not going to get another prescription, right? And then next year, if I see that they were compliant, they didn't have eye infections, like everything ran pretty smoothly, then I may consider changing it into a planned replacement lens. Depending on how it went. But for the first time contact lens wearer, that's what I do in my practice. And I'm very firm on that. Even if I get parent pushback, which I do, I don't change it. That even goes for like kids who wear contacts and don't own glasses. That's a whole nother issue too. Like your kid, or even an adult, but really a kid, you cannot just have contacts and not have glasses. Like I will not give somebody a prescription for contacts if I know they don't have glasses, and I know the parent will not buy them glasses and they'll just buy them contacts. Like I won't do that.
A -6 and cannot see with nothing, but you have no backup pair of glasses. So you just walk around blind when you don't have your contacts.
Or they just don't take their contacts out ever.
Yeah.
Like
ever. I can't ever. It really bugs me when adults don't have a backup pair of glasses. You know what I'm saying? Like it bugs me. Like, what are you doing? And then they come, they want to get, they got an infection. I got to treat now because they abuse their contact lens, and they're still asking me for a trial because they're -5. Yeah, so they're still asking me for a trial to give them so that they can still get home. And it's just like, we talked about this, son.
Or then they're mad because you say like you can't wear contacts.
Get glasses, son.
Yeah.
Like that's not okay. That's not
okay.
Do
y'all feel as far as like how patients kind of take over our exams at times? Do you feel that happens with other professions?
I think it do. I think we have like the Google MD generation where everyone will Google their symptoms. Like, oh, I have this problem. Google said I need this medication, and I know my insurance will cover this. So I want this, this, and this. when they could be completely wrong, but like they come in saying like, I have this, I need this medication, I need you to write the prescription. I don't care what you say, this is what I want. And I feel like that's the generation that we're in. It may happen to us a little bit more because we are still like selling medical devices, whereas contacts and glasses, but I think it happens now more often than it used to. What do y'all think?
I'll tell you this. So my brother's a dentist.
Yeah.
And he recommends X. In dentistry, you get the option to choose if you want to go through. If you need a root canal, you need a root canal, but no one's gonna force you to get it if you don't want it, right?
Mm-hmm.
So he's gonna say, I recommend X. You're gonna say, I want to do Y. This is the thing, right? So if you're a patient and you go against what a doctor tells you to do, you just have to be ready and willing to kind of deal with the consequences. So I think it does happen to a lot of professions where, and I know MDs and other people who will try to push back on what doctors say. But I think that's kind of where it stops. I think it stops with pushing back. For example, hey, I think we should go ahead and start you on amlodipine and losartan, and then we need to give you some lisinopril as well for this. But let's go ahead and start you at this dosage and this and right here and do this. And the patient may say, "Oh man, doc, I really don't want to use medications. Can I diet and exercise, or can we do another way or something?" And in those situations, that happens. You know what I mean? What I'm talking about is like patients sit here and say like, "Nah, like give me the old prescription I had. I don't like." It's like it's a level of disrespect when it comes to optometry. It ain't just regular pushback like, "Oh doc, you know what I'm saying? Can we?" No. This is like, nah, like I don't like, no, give me my contact lenses. I don't care if I'm sleeping in them. I don't care. Matter of fact, they tell you to your face, I sleep in my lenses. Give my contact lenses, right? It's a certain level of like, there's no regard for what, you know what I'm saying? And that's the thing. So please, if you're a patient, if you go see an eye doctor, show them a little bit of, you know what I'm saying? Put some respect on that because, at the end of the day, they do know what, is best for your eyes. And even though you may disagree with it at times, please take heed, man.
But do you think that's because we bend too much, right? So
we
bend too much. So like saying like, okay, you sleep in your daily contact lenses, I'm not writing a contact lens prescription at the end. Like, and they're gonna be mad, but okay, I'm not writing you a contact lens prescription. If you don't have a prescription, you can't buy contacts legally.
Well, guess what, Susanna? But guess what? We need to sell. We need to sell. You see what I'm saying? I need you to buy. I need you to buy them contacts. I need you to buy that. So I'm gonna bend a little bit. That's the problem, though.
For the money.
Because money talks. Money. Because you're gonna say, you're gonna bang the gavel. You're gonna say, nah. You ain't getting contacts. And guess what? They're gonna take with their money. They're gonna take their money and they're gonna come bring it to me, the person that's gonna bend, and give them what you see what I'm saying? So our profession is money based. Like we gotta make, like we sell products. We gotta make money in order to make our businesses run. You know what I'm saying? So in dentistry or in medical school, they sell their services. Their services is what they're selling. They're not, you know what I'm saying? So a dentist is like, look, I'm not selling you any equipment. I'm selling you what I can do. Do you want me to do this procedure on you or not? You know what I'm saying? So that's the difference. We over here, you know what I'm saying? So the respect level, it starts to decrease because they got a little bit more leverage because they got the money and we need to make a sale. Yeah. You know what I'm saying?
That's true.
Yeah, but I still hold prescriptions. I'm be honest, I do.
You do that.
If your eyes jacked up, you're not getting contacts.
I do it on diabetics. I do it on diabetics.
I do it on diabetics. What if they got a bunch of infiltrates? Y'all.
If anything on your cornea is jacked up, you're not getting contacts. You're getting started on medication, and we will read your contacts at a later date. That's how I am. Like any issues with the front part of your eyelids jacked up, styes everywhere, like.
Yeah. When it comes to when it comes to a health concern, when it comes to a health concern, when it comes to a health concern, don't try it. When it comes to like just patient preference, like, nah, give me my like I want this, like give it to me. No. But when it comes to like a health situation, your health is in critical condition. No. We don't play that. You're not getting nothing. We don't need the money that back.
You can't You can't budge on the AccuView 2 wear.
Man,
But you
what?
can though. But you can though.
They don't be
They
playing.
don't budge.
And they say they're comfortable too. I know they ain't comfortable.
They're
I'm
not.
You
seeing
talking about
them all.
AccuView 2? It's discontinued anyway. It's
They'll
discontinued.
find a way to buy them though.
Look,
It's
Also, I'm gonna put out a
discontinued.
PSA
they
for all
still
those
coming
patients.
here with the
Yeah, they'll
AccuView
still buy
2.
them. They'll still buy them. They find their ways. They find their ways. Because they can't buy them from certain offices, but they'll find their ways to buy them. They will. And this is a PSA for everybody watching this podcast. If you're wearing contact lenses that have been discontinued, stop. Stop. If you're wearing contact lenses that you bought from a random website online, stop.
Hold on. Don't do that. Don't do that. Don't start throwing out. All right, so who we gonna throw out there? Who we gonna throw under the bus?
I'm not throwing anybody specific under the bus, but I've had patients come in with like random contacts that are like in Chinese from like UK something direct.com. Like,
man,
look,
I'm
unknown
gonna throw them under the bus. Hey,
like,
just
unknown.
Hey, don't let me. Stop. Hey, hold on now. I'm gonna start throwing some of this under the bus. Hold
Go
on.
ahead.
Let me do it. Let me. You know what I'm saying? Some of y'all know. Hey, look,
like,
some of them
you
know
who you are, so just
they
stop.
know exactly who they are.
Just stop. Like, if you know your lenses are 2-week disposable contacts, you wear the same ones for 6 months. Stop. Throw them away. Just stop. Just stop. It's not good for you. Like, you'll feel better. Just stop. Those are my PSAs for the night. I just like to throw that out there.
Yes, there it is.
So what's the moral of the story, Rochelle?
If you are a new grad, take control of your exam room. Because
the patients will take control of you if you don't. That's the moral of the story.
Quickly. Hey, you know what? And guess what? And when you're a new grad, you give them the whole world too, don't you? You give them the whole world.
Hey, you give them your heart and soul in the exam room, baby.
Yo, when you a new grad, because you don't want no smoke when you're a new grad, right. Yeah. Yo, you don't want no smoke when you're a new grad. So you
make someone.
Patient come through and check you. Yo, you don't want no smoke. You got it, son.
Because oftentimes we may feel like we have to satisfy the patient at all times. Like, there will be times where you may not, that patient just still isn't gonna like you for whatever reason, because you took the initiative to stand your ground on a certain situation. Mm-hmm. Like what's Asani saying? If she's gonna put a kid in a daily, I'm not gonna tell, you're not gonna tell me what type of prescription to give you when clearly I know it could be better. Like there's just times where you're gonna have those, you have to be confident in yourself and show those skills that you know what you're talking about. So that's definitely something as a new grad you are gonna encounter. Just know that, everyone's not going to always be on your side when it comes to how you are going to handle situations and what skills you're going to bring to the table.
Yeah, you have to realize. Go ahead, Zola.
I was going to say, don't let them steal all that minus from you. They don't need all that minus, new grad.
Right.
I'm telling you, trust me.
Anyway, I gotta.
I'm telling you, man. Look, trust me. New grads, they don't need all that minus. Trust me. Go ahead, son.
I was just say, like, you know what you're doing. Like, you went through 4 years of school, optometry school, all your externships, past boards. Like, you know what you're doing. Patients are going to question you. They're going to challenge you just because you look young, because you're a new grad, like, because you're new to them, because you're telling them something different they've never heard before, which I'm probably sure they have heard before, but they're going to act like they've never heard it before. Like, they're 50 years old and they need reading glasses. I've never heard that before. No one ever. Yes, they did. But yes, they did. That's not new.
Look, high cholesterol, arcus ring, deep as can be. I ain't never heard I had cholesterol.
But you know what you're doing. Like,
how dare the eye doctor tell me I have high cholesterol? You know what I mean?
Or diabetic patients, like, just want to get contacts, but best corrected 20/80 because of like macular edema. No, I'm not diabetic. I'm good. They know. and you know they know, like, you know what you're doing. So just use your clinical judgment to the best of your ability and be a doctor. Patients aren't going to like you for being a good doctor. That's okay. But your license is on the line. So do what you know is right, prescribe what you know is right and accurate. I mean, there can be some wiggle room. Like if you think they should be in a daily contact and they prefer to be in a monthly contact, okay, fine, whatever. But do what you know is right and do the best for the patient so you don't mess up their eyes, because it's your license at the end of the day.
Yeah.
So if you guys liked what you heard, like this video, subscribe to our podcast. If you have any other funny patient stories or a patient tried to take over your exam room, let us know. We'd love to hear from you guys. Any tips and tricks that you have for us to maybe gain better control of our exam rooms, leave a comment below and tune into our next episode, because this season has been very interesting. It's about to get real spicy. Peace out, y'all.
All right, y'all. Peace.